So now we're going to move to treating relapsed and refractory or progressive hairy cell leukemia.
So that is an important topic because, as you mentioned, despite the success of purine nucleoside analogs, there's still a significant proportion of patients that would relapse even within the first few years. And also, if you follow patients long enough, there will be more relapses later. So the question is, how does one decide on second-line therapy in hairy cell leukemia? And perhaps you can expand on your practice.
So this is an important topic. The first thing I would say is don't make a mistake which is commonly made in hairy cell leukemia, which is you do a bone marrow at 1 or 2 months and you find that there is a small amount of hairy cell present, and then you feel that the treatment has been a failure. Say it was single agent cladribine, and so the decision is to give another course of cladribine. It's amazing how often that happens. If you do nothing and you just follow that patient, oftentimes by 6 months, they will be a complete responder in complete remission. So hairy cell is one of those diseases that takes a while to respond to the treatment. We don't know exactly why, but it's important not to jump in too quickly up front with a second course of treatment. So that's the first point that I would make. The next point is, when do you decide that a patient really does need second-line treatment? And we use these criteria, which really are the same for first-line treatment. In other words, that they have to have cytopenias, they have to have a hemoglobin less than 10 or 11, or a platelet count less than 100, or a neutrophil count less than 1, or painful splenomegaly, or enlarging lymph nodes, etc., frequent infections. But here, we have to be careful because the low blood counts could be due to the prior treatment if it's too close to the prior treatment. So we have to be cognizant of any potential other reasons why their blood counts might be low. The other thing that I think is important to mention is that when a patient is newly diagnosed, they tend to have a lot of disease because they didn't know that they had hairy cell leukemia. No one's really following them. When a patient's had hairy cell leukemia, then they're being followed a lot more closely. And they tend not to have overwhelmingly large tumor burden when they need second-line treatment. And oftentimes, you can see the counts go up and down. For example, one day their platelet count might be 90, and so you think that they're qualifying for second-line treatment, and then the next month or two, their counts 120 platelet count. So sometimes we like to see several CBCs in a row that really indicate that the patient really does need treatment, or to develop some sort of trend where it looks like the patient really does need treatment. We feel that even though a patient may qualify for retreatment by having a low blood count, if it's just a low platelet count, let's say in the 90s or 80s, and otherwise the patient's doing fine and really wants to avoid additional treatment, sometimes those patients can go for not only months but years being followed. However, if a patient is developing neutropenia down to 0.5 or below, or platelet counts below 50, 40, 30, then we're getting a little anxious that that patient really does need treatment, or else they might develop significant cytopenias from the treatment itself that might put them at risk for complications during the second-line treatment.